on one level to stage 3 in adjuvant. And maybe you can describe for our audience, who's watching this for the first time, what is adjuvant treatment, and what does that mean?
Yep. Yeah. In my clinic, I describe it as additional therapy after surgery to try and minimize the risk of your cancer coming back.
Okay.
So that's
So
the simplest term I can think of.
why? So let's say someone has stage 3 disease. At that point, they have nodal disease, and what do you do at this point? They come to see you.
Yep. As you know, stage 3 is a wide range of
Yeah,
patients and a
yeah,
wide
of course.
range of risk. And certainly it ranges all the way from some of the lowest risk, stage 3A patients, certainly in the new
HACC, yeah.
AJCC, who actually have a quite a favorable prognosis despite
Yeah,
having a positive node.
yeah.
All the way to very, very high risk patients who have a very high rate of recurrence and developing stage 4 disease. My feeling of this controversy, and you're right, different docs feel differently. I would say I tend to offer and recommend adjuvant therapy for certainly the higher risk stage 3s. And I just think there's a value in not having to tell or being able to delay telling a patient they have stage 4 disease, because we can do a lot in the stage 4 setting, but there are a lot of patients who we can't help. There are, patients with brain metastases and other things that are sometimes very resistant to treatment. So I think there's a lot of value in preventing or delaying recurrence. I do think it is the same discussion about risk and benefits, except it's a bit different when you're in this preventative setting. And again, I think you have to understand that. That's not to say that all of my patients get adjuvant therapy, but I think it is certainly worth a discussion for these folks.
So I guess the data is still in question at this point to sort of see whether the adjuvant can improve overall survival. I mean, I know it shows better improved progression-free survival, and
Yep. So I think it's a great point, because historically overall survival has really always been the gold standard, and that's what we equate with cure. But I'll be, to be realistic, because our therapies are quite good in the stage 4 setting. I'm not sure that we're going to see an overall survival benefit in our adjuvant trials. I think that may be a really high bar to prove. But I certainly think there's been sort of a consistent benefit, demonstrated in terms of improvement in relapse-free survival. So I certainly think it's worth consideration for a lot of patients with those higher risk. And so I'm really referring to stage 3B and above.
Yeah, that's what I was going to actually, thank you for mentioning that, because I was going to try to get that clarification. You're absolutely right. 3A somehow, strangely enough, have actually improved better prognosis than some of the stage 2 patients. What about